Hello, my name is Brian Vasic, and I am presenting on mental health awareness and the role of rehabilitation professionals. I chose this topic because I believe our role as rehabilitation professionals tend to get lost when mental health is involved with our patient care. Upon doing some research, I found that both physical therapy and occupational therapy scopes of practice allow for us to promote the health and wellness of all patients, inclusive of anybody with mental health problems. And upon further research, there's a significant disconnect between our mental health practitioners in rehab and the physical and well-being practitioners, PTs, OTs, rec therapists in rehab. So my goal was to create this project titled Mental Health Awareness and the role of rehabilitation professionals to help close that gap between what we as PTs, OTs, rec therapists um, see in our clinic and how we can close that gap and promote further awareness within our facility. The objectives of this project were to produce 4 video vignettes, all involving mental health. The presentations were to go to the staff at the Beaumont Coolidge Health Clinic, a staff of 72 members at last count. The first video was to introduce mental health awareness and the purpose of the project. And the second video was used as a description of pulling in some mental health populations that tend to come through our clinic doors. The third video was to discuss what we can do as far as exercise and setting goals for function and quality of life in patients with mental health issues as well as mental health diagnoses. And then the fourth video was the final push for advocacy as rehab professionals. The general trend through all 4 videos was advocacy and taking action. And the slides that follow will show some of our outcomes of that, I guess, or our production of that. The methods of delivery and presentation: we have bi-monthly meetings within our physical therapy practice. I was allowed to use videos and PowerPoint to get this across to a large number of people within the clinic. We had over 70 some people available, so trying to get as many eyes as possible on these presentations was important. We also had some activities to carry out an awareness throughout these presentations. One, we made a t-shirt with a wall of honor. We had a mom race sign up, which is the local race within our community. And we also had a Jeans Day collection for mental health awareness. Each one of these action activities was tied into our bi-monthly meetings and the presentation, so it really allowed for many people to become aware and get involved. And then the biggest take home was the reference guide, as everyone received a reference guide on the 4th presentation. Here's a list of the videos. I kind of named them as we discussed earlier, that I will be posting. You'll see at the bottom of this YouTube video that I'll have those actual links present, so if you care to watch each video in full, that'll be available to you. However, the total time would be about 35 minutes on top of this 10-minute video. Feel free to do it. You'll probably learn something new, or you'll probably refresh something that you haven't thought about in a while. Those videos are available to you. Below, you'll see on the left the initial sign-up sheet that I created. Employee put their name in, put their name of honor down if they wish to. This was a $5 donation for Jeans Day. Below that is the information on the mom race and the team name for the mom race, and then the depiction of the shirt that we'd hope to have. And then on the right is the actual shirt. We went with black and white due to cost. And you see that there's 12 names listed on the t-shirt. On the front, I received permission from the artist that created that pose for one of our fallen heroes to be allowed to allow that on the shirt. The other outcome here is the resource guide. This is specific to Oakland County. On the left-hand side is a lot of our Beaumont services and other Oakland County services to which we can refer some of our mental health patients to that are looking for further assistance with counseling. And then on the right, we have a more specific phone number for our employees to reference, and the PHQ questionnaire that assesses for depressive disorder, and then a summary of the other activities that we had gone over with the first 3 videos. You'll see on this chart below that from the service learning contract, I set a 75% staff viewing goal of each of the videos and a 20% staff participation. I also set an overall cumulative 75% staff participation at least one of the activities. The overall was met. Greater than 80% of the staff participated in at least one of the activities. This was done by comparing sign-in sheets from each of the video staff meetings and the t-shirt donation / Jeans Day activity. You'll note that video 4 was actually completed, but the stats could not be collected due to the due date of this presentation. Limitations within this project were, of course, technology. There were some video creation problems, PowerPoint voiceover issues, and of course our computer programs at work are severely limited to what we can print off. So trying to get the appropriate handouts to the staff was difficult. I was able to work around it, but it took extra time. The cost, we wanted to keep the cost low because we wanted to get as many people as possible wearing t-shirts. If we went with color, the cost of the t-shirt would have doubled. So we stuck with black and white, and we are currently getting a positive response with that. And then timeline, if you actually look at my timeline, this project actually started in November because of red tape through Beaumont proper. I had to just have several discussions with several people to make sure that I was in compliance with everything at work. So that required some additional time. Some excellent facilitators were the 3 staff members that assisted me in collecting money and starting the mom race team, and the support of the supervisors, which I believe has not been as easy in the past as it was this time, mostly due to the service learning contract. So thank you, Karen Litos, for encouraging me to fill that contract out. Clinical relevance, I believe I stated it earlier, and if you watch the videos, you'll hear it over and over again about how we as rehabilitation professionals can help the mental health community. So in summary, mental health may be supported across the healthcare spectrum, inclusive of rehabilitation professionals. And here's a list of my references. If you watch the videos, you will note that these references follow each video